Foot and mouth disease. For the occurrence, it's a TAD, transboundary animal disease. This means it crosses borders into new countries through products, political crises, transboundary transmissions, and migration. So Australia, New Zealand, Japan, and North and Central America are free of the virus. In the European Union, it was sporadically introduced, and it's endemic in South America, Asia, and Africa. For the etiology of the disease, the foot and mouth virus is a part of the aptovirus genus, which is a part of Picornaviridae. It is ssRNA, which means that it has a short replication time, it's non-enveloped and has good resistance. The virus has 7 serotypes, O and A, which are worldwide, C, which is extremely rare, and SAT 1, 2, and 3. SAT 1, 2, and 3 are found in Africa and Arabia, and there's also Asia 1, which is found in Turkey and the Middle East. There are several subtypes, but there's no cross-protection due to the high variability. For the epidemiology, it's a uroxin virus. It affects even-toe, so cloven-hoofed ungulates, such as ruminants and pigs. It can also infect dogs, hedgehogs, guinea pigs, and humans, so it's a zoonotic infection. The main reservoir are cattle and buffalo, and sheep and goats have mild symptoms. A characteristic of the virus is it has a rapid replication time, and the virus can shed 9 hours after infection. Thousands of infected virus parts are made in one infected cell within a few hours. Pigs can shed a huge amount of the virus in a short period of time. Cattle take a longer period of time. Ruminants remain carriers for years, and swine only remain carriers for a month. Long-term carriage happens in the tonsils, the lymph tissue, and the hoof. The virus is shed before clinical signs. In animals, it can be shed in the discharge, such as the saliva, the milk, especially in dairy cows, and the semen, and in the feces up to 40 days. It can also survive in the environment as it's non-enveloped, which means it has good survival. The virus can survive in frozen meat and milk powder for months. And it can survive in shady areas and humid areas on pasture. For the pathogenesis, the virus enters the body orally, it's the primary way, and the primary replication happens in the laryngeal and pharyngeal lymphoid mucosa, and then viremia occurs, and the secondary replication happens in the epithelial cells on the mucosa and the skin, so it affects the mouth, the feet, and the udder and the teats. It can also cause myocarditis in young animals. For the clinical signs, the incubation period is 3 to 7 days, but it can be up to 21 days. The clinical signs are fever, decreased milk production, and salivation. Many vesicles occur with a tattered edge and a red base. These vesicles occur on the mouth, on the mucosa and the tongue, and on the feet on the coronary band, which causes a loss of the hoof capsule and it leads to lameness, and on the udder and the teat. The vesicles are severe in bovine and goats, but in pigs they're less severe. Sheep get lameness, but they don't get vesicles, and goats get vesicles on the mouth, and the disease can cause myocarditis in young calves. It can also cause myocarditis in lambs and piglets as well. There is no high mortality, but the problem is an economic loss due to the animals having to be slaughtered to prevent the spread. In the pathology, we can see vesicles and a pale heart. In young animals, we can see a myocarditis. For the diagnosis, look at the epidemiology and the clinical signs, such as vesicles, fever, lameness, and salivation. These lead to suspicion, and since it's a notifiable disease, it has to be notified. Laboratory diagnostics are necessary. For the lab diagnostics, there needs to be a buffered transport medium, and they need to be cooled, but not frozen. The sample you can send is 1 gram of vesicular wall epithelium, or oral pharyngeal fluid. To detect the virus directly, you do real-time PCR, or isolation with a marked CPE, and to detect the virus indirectly, you do ELISA and viral neutralization. For the treatment, there is no treatment in the EU or free regions, but in endemic regions you use antibiotics, soft litter, and gentle milking. For prevention and control, to prevent the introduction, you need to follow biosecurity, and raw pork products need to be checked, and no importing from endemic areas. For biosecurity, you can follow isolation and all in, all out, and quarantines. State vet administration rules must be followed. In free countries, there needs to be stamping out, so the carcass needs to be burned and buried. There needs to be a closed herd and movement restrictions. And there also needs to be protection and surveillance zones. In endemic countries, there is vaccination. It protects cows for 6 to 12 months and pigs for 4 to 6 months. It's an inactivated vaccine. The vaccines have type-specific immunity. And animals with the vaccine can still carry and shed the virus. It does not prevent infection. In the case of public health signs, it's mild in humans. It's an occupational disease. It's work-related. So it's only really dangerous for people who are in contact with animals. People can get vesicles on their nails and fingers. They can get mild fever and general symptoms. There can be seroconversion without clinical signs, and people need to wear protective clothing. The UK outbreak happened in 2001 due to untreated waste, and in 2007 due to a lab mistake.